Alright, we will start our assessment, our shoulder assessment, with active free range of motion. Active range of motion. So, Jasmine, let's choose an affected site first, because as far as the protocol is concerned, we need to be doing that last. So let's just go with right extension being the most painful. So we will start with the left side. So I would like you to follow my directions, and we will go through these 6 motions. You will be doing them independently, and once we finish that, we will proceed with the passive range of motion testing. So let's just go with the left side. Please do an abduction for me all the way, bringing, wonderful, and down. So that's abduction, and then bring it to the middle, and then add it. That's horizontal, adduction, and then we will bring it again to 90 degrees, bend the elbow, do an external rotation for me, and then follow up with an internal rotation. Beautiful. And then you can relax. Now we're going to be doing a flexion and extension, please, being the last one. Wonderful. So that's 6 motions. Now we're going to proceed. We're going to continue now we will continue with the affected side being the right side, and we need to watch out for the extension. That's the most painful. Again, let's do with the adduction. Beautiful. And then bring it again horizontally and do an horizontal adduction, please. Wonderful. And reset again, and then bring it again. Bend the elbow, external rotation, please, and then internal rotation. Beautiful. And then bring it down. Now we're going to be proceeding with the flexion, force couple for the extension, and then now we're going to be doing the extension. And perfect. Any pain? No. In any of these motions? No. Think. Okay. So basically this is the shoulder active range of motion testing. Couple things that you need to watch out for is when Jasmine is doing these motions, you need to make sure that she's actually not using her torso so much, just the shoulder joint, because a lot of people will actually have compensatory motions to accomplish the task that you give them. So she could have used her torso to do a lot of abduction or external rotation, internal rotation motions. So you need to watch out for that. That's very important. You're looking for pure range of motion for the shoulder. So it's important that you understand that before you are charting full range of motion on the particular motion that you ask the client to do. Again, just to recap, shoulder range of motion testing, active range of motion, and you start with that. Flexion, extension, internal and external rotation, abduction, and horizontal adduction, because we can't really do adduction purely because of the body being on the way. So we switch that, we substitute that with the horizontal adduction. Okay, thank you. And start with flexion. Limb handling is important, so make sure the client is comfortable. Okay, I'm gonna ask you to come towards the edge of the table, please, while I'm still handling the limb. Okay, you can stop right there. Now slowly just lowering, making sure that it's comfortable. Get a bit of an end feel, small palpation. Okay, you can go middle of the table again. Thank you. Let's just get to abduction at this point. Okay, is that okay? Any pain so far? No. Alright. And then follow up with horizontal adduction. Now watch out the hand placement. While I'm moving the limb, I switch my hand so I don't touch the breast tissue or make it any sort of uncomfortable situation. Now the last two is external rotation, preferably a better hand position for you instead of cross hands, and then internal rotation. I'm gonna repeat that one more time. External rotation and internal rotation, and that's it. And we repeat the same thing on the other side. Let's go through this one more time quickly without any explanation, just like in real time. Flexion. Okay, can I get you towards the edge of the table? Okay, you can stop right there. Extension. You can go middle of the table again. No pain so far?
No.
Let me know if it hurts at any point, okay? And excellent. Very good. Very good. All right, that's it for passive range of motion of the shoulder.
What happened? What happened?
I don't know. We need bloopers apparently. Okay.
That's good. You can cut that part. Keep going.
Keep going. Okay. All right. We're gonna do flexion. And I'm gonna ask my client to come this way, please, towards the edge of the table, towards me. Okay, you can stop right there. A bit more. Okay.
Okay. Sorry, I'm so sorry. Promise.
Doing a resistant range of motion for shoulder, and I will ask my client to hold her arm at this position the whole time. I'm going to be putting from different directions, putting pressure from different directions. Just match my pressure, please. Try not to beat me, that's not the goal. I will put pressure and then just hold your arm right here. I'll count from 5 to 0 and then move on to a different direction, and I will let you know which direction I'm going to be pushing on. Okay? So I'm going to be pushing down, hold, 5, 4, 3, 2, 1. Now I'm going to be pulling up, hold, 5, 4, 3, 2, 1. Excellent. Now from the side, 5, 4, 3, 2, 1. I'm going to be pushing from this direction towards the outside, 5, 4, 3, 2, 1. I'm going to do that again, but I'm going to bring the arm into the open pack position again because sometimes the arm starts moving around. Okay, one more time, 5, 4, 3, 2, 1. Excellent. Now I'm going to try to move you this way. Okay, so don't let me move you. Hold, 5, 4, 3, 2, 1. Excellent. And now other arm, 5, 4, 3, 2, 1. Perfect. And that's it for the testing. So while I'm counting those, I'm judging by the strength of the client the grading of what I'm supposed to be charting. Okay, that's important. So don't just go through the motions, observe and report. Make sure you're paying attention to her strength at all ranges. And of course, we repeat it on the bilateral side. Let me move you, hold, 5, 4, 3, 2, 1. Now I'm going to pull up and hold, hold, hold please. I'm going to pull up, hold.